all, welcome to my channel UGC-NET Social Medicine and Community Health. In this video, we will discuss about one of the national health program, that is minimum needs program. So this minimum needs program was started in the year 1974 during the fifth five-year plan from 1974 to 1978. So the main aim of this minimum needs program was to provide basic necessities to people so that they can live healthier, safe and better lives. So this is the main aim of the minimum needs program. And next, the government promised to the people to give better social and economic life, particularly to those underprivileged, that means poor and disadvantaged people, and underserved, that means people who do not have enough basic services like healthcare, education, clean water or electricity. And next, components of minimum needs program. Components of minimum needs program means, here the main aim of the minimum needs program was to provide basic necessities. So these are the basic necessities. First one is rural health, that means health services in rural areas or villages. And next, rural water supply in villages or rural areas. And also rural electrification, that means electricity in rural areas or villages. And elementary education, that means education for children. And also adult education for adults who won't able to study in their young age. And next, nutrition, better food and nutrition for particularly children and mothers. And next, environmental improvement of urban slum, that means cleaning, drainage, surroundings, clean surroundings of slum areas. And next, houses for landless laborers, to provide houses to who do not own the land. So these are the components of minimum needs program. Next, two basic principles of minimum needs program. First principle is, the government should first provide these basic facilities to the poor areas or villages, like that. Because why? Because if government provide these basic facilities to poor areas or villages means, then the difference between developed and developing country will be decreased. So that is the reason behind this first principle. And next, second principle, the government should provide all the basic facilities together in one area instead of giving only one facility. That means the government should provide all these basic facilities to one particular area. If the government provide only one area, that means rural health, only government was providing rural health means there is no much use. If government provided all these basic facilities like a package of services mean, then only there will be change to that particular area. And next, during the 8th five-year plan, the government set the targets to achieve by the end of the 8th five-year plan. What are those targets? To establish the primary health center, sub-center and community health center. In plain areas, there should be one primary health center for 30,000 population. But in tribal and hilly areas, there should be one primary health center for 20,000 population. Next, a sub-center. In plain areas, there should be one sub-center for 5,000 population. But in hilly and tribal areas, there should be one sub-center for 3,000 population. And next, community health center. There should be one community health center for 1 lakh people or per community development block by the year 2000. So these are the targets that should be achieved by minimum needs program by the end of the 8th five-year plan. So establishing all these primary health centers, sub-center, community health centers are the responsibility of the state government. What are the responsibilities? Establishing primary health center, sub-center, community health center, and also upgrading primary health centers. That means allocating staff and equipment, all these things should be added to the old primary health centers. And next, constructing buildings for these health centers. For primary health centers, sub-centers and community health centers, state government should construct the buildings. So these are the responsibility of state government. And next, nutrition under the minimum needs program. There are some objectives related to nutrition under minimum needs programs. Let us see what are they. First one, to provide nutrition support to 11 million people who are eligible for it, like children, pregnant ladies, breastfeeding mothers, and other vulnerable people. Next one, the government wanted the special nutrition program to be available in every integrated child development services, so that all eligible children and mothers could receive nutritious food and nutrition services. And next, third objective is the government wanted to improve and strengthen the midday meal program. And to that midday meal program, some of the services are connected. What are they? Health services, that means regular health checkups, and potable water, that means drinking and clean water, and sanitation. So these are the services. So this would help children stay healthy, well nourished, and able to learn better. So this is all about the minimum needs program. If you have any doubts, please comment down. If you like this video, please like, share, and subscribe. Thank you.